What we're going to talk about now is how to trigger point check your horse. And the reason we do this is just to have an awareness of what's going on with them. So we can do this daily before you ride. You could do it weekly. I recommend doing it daily just to kind of gauge where they're at and how they're feeling. Charmayne, I know we chatted a little bit about what you do and what you've seen going down the road. They get pretty body sore, right?
They do. You know, you're going to be putting those horses in the trailer for long periods of time if you're going to rodeos. You might be competing 5-6 days out of the week. You're going to be running in deep ground, hard ground. So you're going to see a lot with those horses going on just from the schedule that they're keeping up with. And so, gosh, what a fast, easy way to kind of help eliminate some of that body soreness and just to see what's going on with them and to see what changes. You know, we've all been taught to look at their legs and feel for heat in their legs. Now we need to learn to pay attention to what's going on with their body.
Upper. Yeah, and a lot of it starts below and works upward, and sometimes it's upper and then works downward. So again, this is an overall assessment you can do daily, and then we'll teach you next after this how to incorporate it with the laser. And I don't think he's going to have a whole lot of pain points on him or trigger point syndrome. He does have a little bite right here, so that was reactive. Basically, I'm staying along the top here, maintaining a hands-whip separation. He's got a few trigger points right through here, so from here to here, right through the back end. And I like to check their back twice to make sure I'm not getting a false read. And what do you train on him, a few days a week?
He's getting rode about 5 days a week.
Okay. And you can just palpate the stifles. If you know how to palpate stifles, that's great. I encourage checking for any swelling or fluid on them. Again, it doesn't take long to do. Then we come through the neckline, check the low cervical area down through the shoulder, and this would be good too to check for tightness in shoulders as well.
Yeah,
anything
definitely.
Reactive?
Shoulders are always on the barrel horses. I think we're always trying to keep them loosened up. Whenever they feel like they can move that front end, they just clock faster.
Okay. So this is again how we trigger point check the horse, and what we'll do next is go ahead and show you how to unwind them with the laser and do a pain relief setting.